Welcome to the lecture on the gluteal region. The muscles of the gluteal region include gluteus maximus, gluteus medius, gluteus minimus, tensor fasciae latae, and the deep six. Note that tensor fasciae latae is part of the anterior compartment. The deep six muscles include piriformis, superior gemellus, obturator internus, inferior gemellus, quadratus femoris, and obturator externus. The gluteus maximus is required for power activities such as sprinting, stair climbing, and lifting. One of the main functions of the gluteus maximus is to stabilize the hip joint in both the sagittal and frontal planes. The gluteus maximus counteracts the natural gravitational forces of the hip to go into flexion and adduction. The gluteus maximus provides stabilization to the hip joint in both the open chain and closed chain movements. In the sagittal plane, during open chain movement, the gluteus maximus contracts to control excessive hip flexion, and in the closed chain position, it stabilizes the hip joint by controlling anterior pelvic tilt. In the frontal plane, the gluteus maximus stabilizes the hip during open chain movement to prevent excessive hip adduction, where in closed chain position, it helps to control contralateral pelvic depression. The attachments of the gluteus maximus include the posterior ilium, sacrum, coccyx, and aponeurosis of the rector spinae, the sacral tuberous ligament, the gluteal tuberosity, and the IT band. The IT band is a connective tissue thickening of the fascia lata. The gluteus maximus performs action at the hip joint to include extension, abduction by the superior fibers, adduction by the inferior fibers, and external rotation. The gluteus maximus also has action at the knee joint to stabilize the knee, as it has an attachment through the iliotibial band, or the IT band. The innervation of the gluteus maximus is the inferior gluteal nerve. Pause the lecture to draw in the attachment sites of the gluteus maximus as well as the muscle belly. How does your drawing compare? Gluteus medius. Its attachments are the wing of the ilium and the lateral surface of the greater trochanter. The gluteus medius has action at the hip joint to include flexion by the anterior fibers, extension by the posterior fibers, internal rotation by the anterior fibers, external rotation by the posterior fibers, and abduction, which is performed by all the fibers. The gluteus medius is innervated by the superior gluteal nerve. Pause the lecture to draw in the attachments and the muscle belly of gluteus medius. How does your drawing compare? The gluteus minimus lies deep to the gluteus medius as well as deep to the gluteal blood vessels. The attachments of the gluteus minimus are the outer surface of the ilium and the anterior border of the greater trochanter. The gluteus minimus has action at the hip joint to include flexion, internal rotation by the anterior fibers, abduction, and external rotation by the posterior fibers. Gluteus minimus is innervated by the superior gluteal nerve. Pause the lecture to draw in the attachments and the muscle belly of gluteus minimus. How does your drawing compare? Gluteus medius and gluteus minimus play a very important role during gait. Gluteus medius and gluteus minimus are primary abductors of the hip joint. During gait, they are also primary elevators of the opposite side of the pelvis when the foot is off the floor. So, the right gluteus medius and minimus elevate the left side of the pelvis when the left foot is off the floor. The left gluteus medius and minimus elevate the right side of the pelvis when the right foot is off the floor. Weakness of the gluteus minimus and gluteus medius will cause a gait deviation called the gluteus medius limp. This is where the opposite side of the pelvis drops when the foot is off the floor. So, for example, if there's weakness of the right gluteus medius and minimus, this will lead to the left side of the pelvis dropping when the left foot is off the floor. When there's weakness of the left gluteus medius and minimus, this leads to the right side of the pelvis dropping when the right foot is off the floor. Individuals with the gluteus medius limp due to weakness of the gluteus minimus and medius will compensate and tend to lead toward the side of weakness when lifting the opposite off the floor. This particular type of gait pattern, when there's compensation due to the weakness, is called a Trendelenburg gait. So you will see trunk lean to the right when the left foot is off the floor, when the right gluteus medius and right gluteus minimus are weak. You will see trunk lean to the left when the right foot is off the floor, and the left gluteus medius and left gluteus minimus muscles are weak. This diagram is depicting the function of the right gluteus minimus and gluteus medius during gait as it is elevating the left side of the pelvis during the swing phase of the left lower extremity. Or in other words, when the left foot is off the ground, the gluteus medius will contract to elevate the left side of the pelvis. Tensor fascia latae. The attachments of the tensor fascia latae include the lateral aspect of the iliac crest, the anterior superior iliac spine, and the IT band. In fact, the tensor fascia latae is embedded within the IT band. The tensor fascia latae performs hip flexion, hip abduction, and hip internal rotation. It also has a function similar to the gluteus maximus to help stabilize the hip joint by holding the head of the femur in the acetabulum. The tensor fascia latae also has action at the knee joint to stabilize the knee due to its attachment to the iliotibial band. The tensor fascia latae is innervated by the superior gluteal nerve. Pause the lecture to draw in the muscle attachments and the muscle belly of tensor fascia latae. How does your drawing compare? Note that the muscle belly in red is embedded within the IT band. Piriformis. The sciatic nerve most often passes inferior to the piriformis muscle belly. In some individuals, the common fibular component of the sciatic nerve will pierce through the piriformis muscle. The piriformis muscle's attachments are the anterior surface of the sacrum and the superior border of the greater trochanter. The piriformis performs hip abduction, hip external rotation, and hip internal rotation when the hip is flexed to greater than 90 degrees. The innervation of the piriformis is the nerve to piriformis. Pause the lecture to draw in the muscle attachments and muscle belly of the piriformis muscle. How does your drawing compare? Superior gemellus. The attachments of the superior gemellus include the ischial spine and the greater trochanter. The actions of the superior gemellus at the hip joint are external rotation and abduction when the hip is in flexion. The innervation of the superior gemellus is the nerve to obturator internus. Pause the lecture to draw in the attachments and the muscle belly of the superior gemellus. How does your drawing compare? Obturator internus. This muscle will be found lying between the superior gemellus and the inferior gemellus. The obturator internus's activity impacts the activity of the levator ani muscle because of their common connection to the tendinous arch. The attachments of the obturator internus include the interior aspect of the obturator foramen, the internal surface of the pubic and ischial rami, and the greater trochanter. The obturator internus has action at the hip joint to include external rotation and hip abduction when the hip is in flexion. The innervation of obturator internus is the nerve to obturator internus. Pause the lecture to draw in the attachments and the muscle belly of obturator internus. How does your drawing compare? Inferior gemellus. The attachment sites of inferior gemellus are the ischial tuberosity and the greater trochanter. The actions at the hip joint of inferior gemellus include external rotation and abduction when the hip is in flexion. The innervation of the inferior gemellus is the nerve to quadratus femoris. Pause the lecture to draw on the attachments and muscle belly of inferior gemellus. How does your drawing compare? Quadratus femoris is a quad-shaped muscle attached to the ischial tuberosity and the quadrate tubercle. The quadratus femoris has action at the hip to include external rotation and adduction. The innervation of quadratus femoris is the nerve to quadratus femoris. Pause the lecture to draw in the attachments and the muscle belly of quadratus femoris. How does your drawing compare? Obturator externus. The obturator externus lies deep to the quadratus femoris from a posterior view. It also lies deep to pectineus from an anterior view. The attachments of the obturator externus include the external surface of the obturator foramen and the trochanteric fossa. The obturator externus has action at the hip to include external rotation. The innervation of obturator externus is the obturator nerve. Pause the lecture to draw in the attachments and the muscle belly of obturator externus. How does your drawing compare? Note that the dotted lines indicate that the muscle belly or tendon is on the posterior aspect of the femur. Now I'd like to go over a connective tissue structure of the gluteal region. This is the iliotibial band, also called the IT band. The IT band is a thickening of the fascia lata. The IT band is attached to the anterior superior iliac spine, embeds the tensor fasciae latae muscle, and courses distally to attach to the Gerdy's tubercle. Gerdy's tubercle is a tubercle on the lateral condyle of the tibia. The main function of the IT band is to stabilize the knee when it is in extension. Pause the lecture to draw in the IT band. How does your drawing compare? Now let's talk about the nerves and arteries of the gluteal region. When looking at the nerves and arteries of the gluteal region, we use the piriformis as a landmark. The structures that exit superior to the piriformis include the superior gluteal nerve and the superior gluteal artery. The superior gluteal nerve innervates the gluteus medius, gluteus minimus, and tensor fasciae latae muscles. The superior gluteal artery is a branch of the internal iliac artery. The structures that exit inferior to the piriformis include the inferior gluteal nerve, inferior gluteal artery, sciatic nerve, pudendal nerve, and internal pudendal artery. The inferior gluteal nerve innervates the gluteus maximus muscle. Also know that the inferior gluteal artery branch of the internal iliac artery. Pause the lecture to take this opportunity to draw in the nerves and arteries of the gluteal region, using the piriformis as your landmark. Start by drawing in the sacrospinous and sacrotuberous ligaments to form the greater sciatic foramen and the lesser sciatic foramen. Then draw in the piriformis muscle, and then the nerves and arteries or blood vessels that exit superior and inferior to the piriformis muscle.